I'm Dr. Suzanne Magab and I'm the clinical lead for stroke across Poole Hospital and the Royal Bournemouth and Christchurch hospitals. We are very proud of our stroke services, which are nationally recognised as being high quality. However, there are a few areas where there is room for improvement. One of these is in the first 72 hours after stroke, where we know that patients are more likely to recover if they receive care on a hyperacute stroke unit with higher intensity nursing, access to rapid diagnostic scans and stroke specialist consultants. Currently, neither hospital is able to provide weekend ward rounds with stroke consultants, high dependency nursing or consistent 7-day therapy. For some time now, we have been working hard on plans to introduce compliant hyperacute stroke unit care, and I'm delighted to be able to share with you that we are now in a position to be able to do this. For this year, anyone who is suspected to have had a stroke will be admitted to the Royal Bournemouth Hospital, where there will be a hyperacute stroke unit, including higher intensity nursing, a 7-day stroke consultant service and 7-day therapy. Patients will stay on the hyperacute stroke unit for up to 72 hours following their stroke. If they need to stay in hospital for a longer period, they will transfer onto an acute stroke unit. There will be an acute stroke unit at both Poole Hospital and the Royal Bournemouth Hospital. For those living in the Poole area, if they need to stay in hospital for more than a few days, they will be repatriated from the Royal Bournemouth Hospital back to the acute stroke unit at Poole Hospital to continue their recovery. Learning from stroke service reconfigurations that have taken place across the UK, the provision of hyperacute stroke unit care results in a higher level of survival following a stroke and better outcomes and quality of life after stroke. The changes we are implementing will benefit approximately 1,300 people living within the local area every year. These changes also align with the recommendations for stroke in the NHS long-term plan. Alongside the changes to our stroke pathway, we will also be making improvements to our transient ischaemic attack service. Transient ischemic attack, or TIA, is a mini-stroke when an individual experiences symptoms of a stroke for a short-lived period of time. TIA requires an urgent response to reduce risk of stroke. All weekday TIA appointments will be provided at Poole Hospital in a new dedicated TIA clinic suite. Through combining the TIA workforce from the two hospitals, we will be able to provide more robust and sustainable TIA services away from the competing demands of the hyperacute stroke unit. These changes will benefit approximately 1,700 suspected TIA patients per year. We have been working together with our clinicians, our patients, and with our partners such as the Ambulance Trust and the Stroke Association to develop and test our plans. We are also extremely fortunate to be working together with Simon and Alison, who have had first-hand experience of stroke services in Poole and the Royal Bournemouth hospitals, and their input into developing our plans from a patient and carer perspective is invaluable.
In early 2018, I had a stroke, which was a life-changing event for me and my wife. We've experienced the stroke admission service at both Poole and the Royal Bournemouth hospitals and spent time on the stroke units in each hospital. We've also experienced hospital care in a range of hospitals, services and settings from our time living and working in London.
Because of our experiences, we felt we could contribute to the design of the stroke services in Bournemouth and Poole hospitals, and we're pleased to be the patient and carer representatives for this work. Over the past 2 years together with clinical staff and managers from both trusts, we have been part of a joint stroke steering board for Bournemouth and Poole hospitals, which has overseen the development of these plans. This board has put considerable time, effort and energy into developing and testing these plans. Being part of this, we have seen firsthand the dedication of the clinical staff and the managers to improve the services they provide and their desire to deliver the very best care for their patients. These plans will benefit patients of the future, ensuring they will receive the high-intensity nursing care that they need following their stroke, access to occupational therapy, physio and speech therapy, and are able to be seen by a stroke consultant at the weekend.
There are huge benefits for those patients that need that specialist care. They are going to get that specialist care. They are going to have the best possible care in the best place. It may not be round the corner for them. They may have to travel a little bit further. Their families may have to travel somewhat further. But having that experience and that knowledge in one place means that they are going to make the best possible recoveries, and that's what it's all about.
We are very excited about our plans for stroke and TIA services in Poole and the Royal Bournemouth hospitals. For further details about these changes and all our reconfiguration plans, please visit our website.